HMO, PPO, there are so many different three-letter abbreviations, all standing for some sort of third-party payment plan. And in this lecture, we're going to go over the differences between an HMO and a PPO. Now, just in review, usually whenever you get a job, you'll get an insurance plan, and that insurance plan will have different benefits, and you can compare and contrast different plans. Some of those plans may have these three letters, like an HMO or a PPO. It's important to be able to know the difference between those. It's possible that you may have a patient that comes to you and says, could you help me choose between these few different plans? Particularly seniors may do that. So let's delve into the material here. Not only will it be good for your work, but also you may see it on your exam. We'll start with an HMO, the Health Maintenance Organization. In an HMO, you have to choose a PCP, or a primary care physician. So your HMO will determine from a select list of physicians which one will be your primary care physician. They're kind of the gatekeeper of your health care. The physician manages all of that health care, and then should you need some sort of specialty work, your primary care physician will then refer you. So if you want to get a certain lab done, or if you need to go to a certain specialist, you will first go to your primary care physician, and then they will refer you to an oncologist for cancer, to a hematologist for blood, for whatever specialty you might need. Got hurt and need physical therapy, we're going to have a prescription for that from your primary care physician. So a health maintenance organization utilizes the PCP, utilizes the primary care physician. Next comes up is a PPO, a preferred provider organization. Now this has contracts with a group of so-called preferred providers. Now we don't need this PCP that we needed in the HMO. We don't need referrals to go to a specialist. Now we simply have contracts with this group of preferred providers. Usually you just need a simple deductible for in-network visits. Now let's say you have the doctor that is out of network and you really want to use this doctor. Well, if they're out of network, it's going to incur an additional cost to you. So maybe if this elderly person that asks you about different plans has a really favorite doctor they want to just keep on going to, well, if it's out of network, they need to be aware that there could be additional costs associated with that out of network doctor. So in a review for PPO, we don't have a primary care physician. We don't need a referral for some of our specialty work. Instead, we're just going to have a group of preferred providers, and a simple deductible will work for most of these. Next comes up is Medicare and Medicaid. These two terms are often, even amongst veterans in the healthcare field, interchanged and mixed up with each other. So let's go over real quick. This first slide will be Medicaid, C-A-I-D. We'll start out with CMS, and it's the Centers for Medicare and Medicaid Services. You can check out their website at cms.gov. So Medicaid is what is used for insurance for individuals that have insufficient resources to pay for health care. The government will allow for them to get certain low-cost items. Sometimes you'll be surprised what Medicaid will pay for, but health insurance for individuals with insufficient resources to pay for health care. So it's a social program. Everybody that is employed will contribute to this pot, and from that pot resources will come the funds to be able to pay for Medicaid. So in a review, Medicaid is for individuals with insufficient resources, and it comes from the Centers for Medicare and Medicaid Services, as does Medicare. When you hear Medicare, you should think elderly. Unusual. There are some exceptions, but it's health insurance plan for individuals age 65 and older, and as you see with the second bullet point that I just mentioned, others may be included. Now these next three bullet points are very important, and I want you to know them. We have Part A, Part B, and Part D. Those are very important. There is a Part C, but I'm not as interested in that because these are the ones you're going to see the most often. Part A is hospital. If you're over 65, you have Medicare, you're headed to the hospital, you're going to have to be paying for it with Medicare. Part A is an apple. Next is Part B, which is outpatient medical services. You're going to the family doctor. You're going to the Minute Clinic up the street. You're going to use medical services, and that is Part B as in boy. You'll notice I'll say Part B as in boy or Part D as in dog because they're easy to mess up. And especially if you're talking over the phone, I recommend differentiating them like that. So Part D, I always remember it's Part D for drug. So Part D for drug, that's the outpatient prescription drugs. And this is all bundled into Medicare. So Medicare primarily for individuals over 65 years of age, Medicaid primarily for individuals that have insufficient resources to pay for their medical expenses. So that was fairly simple. We talked about HMOs and PPOs. We also talked about Medicaid and Medicare and the difference between those. They are very often confused. So you will be above and ahead of the pack if you will just know the difference between Medicaid and Medicare. So with that, learn these different types of plans and be able to explain them to any patient that might need to know about them. And then lastly, know it well enough, particularly those Medicare parts, Part A, B, and D, know it well enough to regurgitate it on the test. So with that, look it over, watch the video again if you need it, and memorize it.